Well, the World Health Organization has approved a new vaccine to protect children against pneumonia. The vaccine is only the third to be developed in the last 20 years and will be much cheaper than the existing treatments from Pfizer and GSK. Let's talk about this now and bring in Alaa Al-Sahani from the organization Doctors Without Borders. He is live for us in Paris, joining us via Skype. Alaa, very good evening to you and thank you for being with us. So put into context then the scientific difference between this vaccine and what's already on the market.
Yes, good evening. So it is important to know that this vaccine was approved based on its equivalence with the two existing vaccines. So from WHO perspective, if they approve this vaccine, it means that it is at least as safe and effective as the two ones that are already WHO pre-qualified from Pfizer and GSK, respectively.
And it's only the third, I understand, third pneumonia vaccine to be developed in 20 years. That seems like a terribly long time. Why are we only on the third?
Yes, so actually it's a vaccine that is technically it has been quite difficult to develop it. So it's a vaccine that was developed by a Serum Institute of India in collaboration with PATH, which is a not-for-profit organization working in the area of health technology. It's a vaccine that is technically quite complex. So they started working on it in 2008. And what is important to know is that it's a vaccine that from the very conception, it was decided to have something that is going to better fit the needs in developing countries. So, for instance, it's a vaccine that better captures the serotypes of pneumonia that exist in countries in Africa, Latin America, and Southeast Asia. So, yes, it took 12 years, but I think there was also a lot of work that was done to optimize the production process so that the cost of the vaccine ultimately was going to be much lower. So we're having a vaccine that is priced 1/10, for instance, of what a vaccine from the same vaccine for PCV from Pfizer costs to some African countries.
And Alaa, I want to talk about the cost factor because that is important. In the past 20 years, Pfizer and GSK have had what's been described as a duopoly on the existing vaccines, which in turn has left millions of children in developing countries unable to access this crucial form of treatment. How is it that to this day pharmaceuticals are still allowed to hold such monopolies that essentially put millions of lives at risk?
Right. So from our experience, actually, when you look at new vaccines, which was the case of PCV 20 years ago, the only moment where the price that keeps prices quite high. And yes, I mean, today we have a situation where a lot of the kids that are not being vaccinated live in countries where the vaccine has not been introduced yet by the government. So we hope that now that there is an affordable vaccine, $2 a dose, these countries are going to introduce it in their national immunization programs.
Affordable but not free, this vaccine is. So in terms of the quickness with which it can be dispensed, how soon is that likely to happen?
Yes, so we know from our discussions with the manufacturer that they have a pretty important production capacity, so they should be able to cover the needs globally. Now, the vaccine has been pre-qualified, of course, but there is still an additional step. So countries that are willing to buy this vaccine need to register the vaccine at the national level. This might take some time. It depends on each country. And then it's a question of obviously having it deployed through their national immunization programs.
And by amount of time, could it take years, possibly?
Well, I mean, I guess, in average, it takes 6 to 1 year for a product for a country to register a product. In terms of production, we know that there are already some stocks available from the manufacturer.
All right. Alaa Al-Sahani speaking to us from Paris. He's with Doctors Without Borders. Thank you so much for your time tonight.